Hello, my name is Ashley, this is Faithful Rattos, and welcome back. So in today's video we are going to talk about caring for older rats, senior rats, elderly rats. Lots of people call them different things. Some people call them golden oldies. But yeah, we're going to be talking about older rats today in this video. We're going to be talking about their care, what is special about their care, how to properly support them, what medical health needs you might need to watch out for, and monitoring quality of life and eventual euthanasia if necessary. So the first thing that I will say is what is an older rat. Let's quantify what I mean by an older rat. Now this really does depend, as some rats age sooner and faster than others. Some rats do live longer. However, the general sort of lifespan that we're looking at for rats is about 2 years. So they start to become older rats at around 18 to 20 months depending on the rats. Does do live a little bit longer on average than bucks. However, they still do only live about 2 years. You may get lucky and have a rat that lives to 2, 2.5 or 3, but this is not the norm. This is something that can happen, especially well-bred, well-cared for rats, but it's not the standard. And I see a lot of people boasting about 4-year-old rats and 6-year-old rats, and that's really not likely. So don't feel bad about your rat getting old at a normal time, at 18 months, 2 years old. So first, going to go through a couple of health issues they may run into. Now some of these are possible with younger rats. However, they are much more common with older rats. As with humans, older people, older rats do run into more health issues and more often have health issues. So one of the big ones that you may already be aware of is hindline degeneration, or HLD. There is a few causes for HLD. Sometimes it's just muscle wastage, sometimes it's due to the kidneys, sometimes it is due to nerve pain and things like that. So it is good to get them checked out and make sure that everything is in working order. Kidney failure and renal degradation can be a part of why a rat gets HLD, especially bucks. So do keep an eye on their kidneys as well, especially for older bucks. So with HLD, because this is basically a degenerative paralysis of the back legs, this is going to need you to adapt to the cage when necessary. Now, when you first start noticing the signs of HLD, it's not the time to take out anything challenging and make it all easy and just add ramps and things like that. Keeping them active keeps their muscle for as long as possible, but it is important to be aware of their limitations, what they can and can't do, and make sure they have a safe environment to live in. Adding in more fall breakers, more perches to stand on and rest is really important, but also don't make it too easy for them too quickly, because they will lose that muscle mass even quicker if they're not using it. One thing to note with HLD is that when they start to drag their legs, this can produce sores on the inside, on the outsides of their legs, and it's really important to keep an eye on that. And if your rat is getting to the point where they do have sores on their back legs from HLD, I personally think that is a time to consider their quality of life and let them go, because that is only going to get worse. There's not really anything you can do to stop that from happening once it's started. Sometimes they'll need help with grooming, so this can be taking a cotton bud and just cleaning out the exterior of their ear. That's because obviously they use their back legs to clean their ears. If you've ever seen a rat clean their ears, they use their back leg and they lick and clean. Very gross, but if their back legs are not working too well, then they're going to struggle with this. So that's one thing to look out for. Another thing, especially in male rats, is to check for penis plugs. Now this is just a buildup of smegma and semen and everything down there, and if they aren't cleaning properly, if they can't get to it, it can cause a build-up, and that blockage can actually really seriously impact their kidneys and their urinary tract. So you want to make sure that isn't happening. The next bunch of health issues are the neurological ones. So this involves strokes, pituitary tumours. Sometimes the symptoms of these can look pretty similar. So this is loss of function in the hands, odd behaviour, not being able to eat. PTs especially, one of the major symptoms is balled fists, not being able to hold things properly. So this is something to look out for. With a stroke, sometimes these symptoms are more sudden, more severe, but they are similar symptoms because they're all neurological. So this is something that you really should assess. When it comes to neurological issues, your best bet is to get on steroids, and if it's a PT, also cabergoline. Cabergoline can also help with that because of the way the brain works and the way the drug works. So that is an option. but often a PT will cause them to decline rapidly, and the kindest thing to do is put them to sleep on diagnosis, but obviously it depends case by case and the exact situation that you're in. Then we mentioned slightly before, but kidney failure, this is something that can happen to all older rats, but it is more common in bucks. So make sure their diet is lower in protein, less phosphorus, so this is avoiding grains like wheat, things like that, less potassium, so not too many banana chips and things like that. You can also supplement their kidneys with a supplement called ipaketine, which helps to bind to the phosphorus to give the kidneys a bit more pressure off. So that's something to consider. When it comes to feeding older rats, Alison Campbell's The Scuttling Gourmet has an excellent section on feeding older rats. So if you are particularly interested in that, I would recommend buying her book and checking that out. Then we also have heart failure, which is common in older rats. I've had a bunch of cases of heart failure. Sometimes vets will confuse these symptoms for respiratory infection or pneumonia, things like that, because they do show sort of struggles and effort in the breathing. If this is the case, I would also recommend doing a Fruzol trial alongside antibiotics in the case of older rats, because it is a lot more common that those symptoms are from heart failure rather than just the run-of-the-mill respiratory infection or even pneumonia. And sometimes this can get missed, especially with non-rat savvy vets, so I would recommend doing that. Some vets will want to do an x-ray and scans and things. However, with rats, unless it's very obvious, it's very difficult to diagnose that way, and Fruzol is a much cheaper, quicker way of seeing if that is what's going on, because it's only a couple of days worth of trial before it should have an effect. So I would always recommend that with older rats. Another one, which is more aimed towards does, although bucks can also get them, is mammary tumours. I would also consider, is an op the right thing for that rat at that time? Because we all know that the older the rat gets, the more vulnerable they are and the riskier the anaesthesia is. So that is something to consider. It is more common for older rats to get mammary tumours. When does have been spayed in their younger life, like around 6 months, they do have a decreased risk of getting mammary tumours. You can also try cabergoline as a treatment for tumours, as some prolactin based tumours do respond very well to this. I have experience of that. It has kept tumours small for does that I've used it on, but it doesn't always work for tumours that aren't caused by prolactin. So the next health issue is just general pain, old age pain, arthritic pain, things like that. And you can treat this with your vet with various different types of pain management. What I will say though is that NSAIDs like Metacam, Loxicon, this is all the same drug, basically ibuprofen that we take. These drugs can have an impact on the kidneys. So especially in older rats, if you're doing long time use of Metacam as pain reliever, I would keep an eye on the kidneys. And you can do this at home by using urinalysis strips and checking for protein and also blood and leukocytes in the protein in the wee. There are other drugs like gabapentin and other things that you can use for pain management, but it depends what pain you're dealing with, so obviously discuss with your vet. There are other supplements you can give older rats, so one of them that I like to give is glucosamine, or a supplement that involves glucosamine, because glucosamine is very good for joints, so that's another thing that I will use for my older rats alongside ipaketine. As I mentioned, there is a huge section in Alison Campbell's The New Scuttling Gourmet about feeding older rats. In fact, she has sections on feeding rats at all stages of life, so it's really helpful if you want to deep dive more into diet on that front. That's not my expertise, so yeah, I'd have a read of that chapter. General, we're also looking at things like weight loss and muscle loss in particular, especially in the back region. So this can often require you to feed up the rats to keep the weight on so they don't become very, very skinny and slim. I use Weight Up Baby from Rat Warehouse, but there is a similar food called Moo Mix that is available on rat rations, or you can mix up your own using baby porridge and Complan and things like that. It is really important to keep the weight on the rats because that does help them get through any illness, and if they do become unwell they will lose weight more rapidly, so trying to keep the weight on them is really good. So monitoring weight is very important when it comes to our older rats, even more so than with our younger rats. I'm going to move on from the health conditions and things to look out for when it comes to older rats and start to talk about other things. So when it comes to older rats, or golden oldies as I like to call them, or the twilight months of the rat's life, I do find that because you've had a relationship with them for so long and they're starting to become slower and less active, that this is a time in their life that you can have a really special bond with them. That when they're older, they are slower, they like cuddles more. Now this is a generalization, it doesn't go for all rats, but my boy Ezio, who we sadly had put to sleep today, he was an active, no hands on me rat when he was younger, and when he became older he was a much more cuddly rat and enjoyed being held and had head strokes, and he would always boggle when that happened. So yes, you can create and build a very, very special bond with your older rats, especially if you're spending more time with them, giving them extra food or medication or extra health checks and things like that. It's not all sad, it's not all bad when it comes to older rats. Older rats can be absolutely incredible. I've had a good few old rats now, some that I have raised since they were young, and some that came to me as older rats, as lone rats for company. And all of them have been super special and sweet, and there is nothing like the bond with an older rat, and I really hope for that for you in your rat care journey, because it is really wonderful to see them get to the end of their life. And sorry, I probably shouldn't have filmed this video a couple of hours having Ezio put to sleep, but there is something really special about seeing a rat get to the end of their life and be happy and relatively healthy and not have to deal with any worry or stress or pain or suffering. So we're going to talk about quality of life and eventual put to sleep, as this is common for older rats. Sometimes they do us a great kindness and go in their sleep. I've not experienced that yet. However, when it comes to quality of life, obviously there is a case-by-case basis, and it really depends on the rat and what they're dealing with. What I will say, that often in old age, you're making a quality of life decision based on preventing incoming suffering rather than ending when it's happening. So with Ezio, his HLD was very severe. His back legs, the hair was very short and had been rubbed away, and actually when I was holding his body afterwards, I did find that he had sort of scabs and sores on the inner parts of his legs, so it was definitely his time to avoid eventual pain and suffering. But what I will say, and it's things like mammary tumours and other sort of old age, just general things, that quality of life can be a really tricky decision to make, and obviously you want as much time with them as possible, but it is really my philosophy that a week too soon is better than a day too late. I would rather prevent suffering when I know it's coming than wait for it and then have an emergency situation on my hands, because it's not nice for me and it's not nice for them. Having a planned put to sleep is very, I mean, the anticipatory grief is difficult, but I think that it's much easier to manage and I can process it better that way, and they also don't need to suffer through pain unnecessarily. I will share some clips of some of the oldie moments I've had with Ezio over the past week or so, knowing that his time was coming soon. It's a beautiful, glorious sunny day after having snow yesterday. So it's been difficult, but he was 27 months old and full of life and happy, and he went happy and peacefully, and he never knew suffering or pain or illness in his life, and that's all you can wish for when it comes to a rat. So yes. I hope this was helpful. I hope that this sort of prepared you for things that you may have to deal with when it comes to elderly rats. And yeah, they're special creatures, and we can have a really special bond with them as they get older. I really don't want people to be scared of those last few months, because they can be very special and very beautiful. They do end very painfully though. So yeah, thanks very much for watching this video. I hoped it was helpful, and I'll see you in the next one.